Hand hygiene is the best way we can prevent the spread of infection. You can either use soap and water or alcohol-based hand rub to decontaminate your hands. Alcohol-based hand rubs are the gold standard for hand hygiene because they are quick and effective at decontaminating hands. Alcohol-based hand rub should always be located and stored safely. There may be some settings where alcohol-based hand rub is not safe to be left in patient areas, or there are limited hand wash sinks. So you will need to have a small personal container that you carry around with you that can either be attached using a toggle, if safe to do so, or one that will fit inside a pocket or belt. Always use soap and water when hands are visibly dirty, or when caring for someone with vomiting and/or diarrheal diseases, or any other enteric illnesses. Alcohol-based hand rub contains synthetic alcohol, so does not fall under the Muslim prohibition against natural alcohol from fermented fruit or grain. Whether you are using soap and water or alcohol-based hand rub to decontaminate your hands, the technique used is always the same. Step 1. Cover your hands with water. Step 2. Apply enough soap to cover all hand surfaces. Step 3. Rub hands palm to palm. Step 4. Right palm over the back of the other hand with interlaced fingers and vice versa. Step 5. Palm to palm with fingers interlaced. Step 6. Backs of fingers to opposing palms with fingers interlaced. Step 7. Rotational rubbing of the thumb clasped in the right palm and vice versa. Step 8. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Step 9. Rinse your hands with water. Step 10. Dry your hands thoroughly with a paper towel. Remember, it should take 30 to 40 seconds to decontaminate your hands, then your hands will be safe. And if you're using alcohol-based hand rub, cover the hands completely and, using the same technique, rub until completely dry. To protect your patients, your family and yourself, you must always decontaminate your hands at the following times. This is known as the 5 moments for hand hygiene. Before touching a patient. Before cleaning or an aseptic procedure. After body fluid exposure risk. After touching a patient. After touching a patient's immediate surroundings. There are also other times when hand hygiene is required outside of the well-known 5 moments. Before and after glove use. Before food preparation. After using the toilet or bathroom. When hands are visibly dirty. Hand hygiene of our patients is equally important and should be encouraged before they eat a meal and after using the toilet or bathroom. Remember to safely protect yourself, your patients, and your family. Always ensure you decontaminate your hands at the correct moments, using the correct technique and the correct method to protect yourself, your patients, and your family.